CidalTek Surgical Scrub is composed of Chlorohexidine Gluconate solution. Surgical site infections are prevalent in healthcare settings. Hence, preoperative surgical hand preparation using CidalTek Surgical Scrub for the hands, forearms and nails prior to any surgery will decrease its incidence. The aim of scrubbing is to remove any debris or microorganisms present on the hands or forearms, thus decreasing the chances of patient coming in contact with any microorganism that may lead to infection. Scrubbing must be done by following particular procedure and must be completed in 3 to 5 minutes. The procedure should be repeated if any unsterile object or material is touched. Before beginning the procedure, one must remove all the jewelry from the hands and arms. Also check if the skin and nails are free from any cuts or wounds. Artificial nails and extensions are not allowed in the operating rooms. Now don the PPE as per the WHO guidelines for donning the PPE. Wet your hands by opening the tap using the elbow. Once done, wet your hands and forearms and perform a pre-scrub wash using CidalTek Surgical Scrub for around 30 seconds. This pre-scrub wash is performed to remove any excess dirt and contamination prior to performing the proper surgical scrubbing. CidalTek Surgical Scrub is applied to the hands. The process starts by scrubbing the hands palm to palm, the interdigit spaces, then the thumb and each finger of both hands. The fingers are interlocked and the hands are scrubbed. The entire step lasts for 3 minutes. Then the wrists of the hands are scrubbed, followed by the forearm. Once done, the hands and the forearms are rinsed thoroughly, ensuring that the hands remain above the elbow and dried with a sterile towel. Follow the WHO surgical hand preparation steps.